I think a lot of people are surprised when we talk about nurses and healthcare professionals not accessing care. I think a lot of people sit there going, well, these are the ones who understand the importance of it, yet it's really difficult to get them to engage. Why would you say that is?
When anything is this problematic, it's usually multifactorial. But one of the big issues we're addressing right now is the questions that we have to ask as licensed healthcare professionals to get our licenses, to get credentialed in a healthcare system, and then the questions that are asked upon hiring. The questions on licensure, the questions on hiring, the questions on credentialing, they were all designed with good intentions to protect the public. But we now know that those intrusive questions about your past mental health history or the medications that you're taking, they violate the American Disabilities Act, and they also are associated with suicide. The good news is there's advocacy being done right now to change all of this from the past. You can download a QR code from the Lorna Breen Foundation website. The Lorna Breen Foundation has been set up to address these issues of stigma against mental health seeking behaviors. And they developed a great toolkit for you to assess your licensing, credentialing, or hiring questions to see if they comply with the ADA.
And the other good thing is that people at An Afternoon of Hope, you can go to our resources page, and there you can find the toolkit as well. I hear that UC San Diego has one of the best programs in the nation when it comes to supporting workers in suicide prevention.
Mark, thank you so much for asking me about that. We're really proud of this program. It's called the Healer Education Assessment and Referral Program HEAR, the HEAR program. And the way it works is we partner with the American Foundation of Suicide Prevention. They developed a screening tool that covers many different forms of mental health problems: depression, anxiety, sleep disorders, substance use disorders, you name it, it's in there. And we send a message to every employee at least once a year, asking them to proactively take care of their own mental health by doing the screening to see if maybe they would benefit from treatment. All you need to do is contact the American Foundation of Suicide Prevention, ask them about the interactive screening program, and you can set up a process to deploy this in your company to safely screen staff for mental health issues.
I mean, that is so key, making people feel comfortable that it's confidential. Because if anyone has any concern about it being found out, their job being at stake, anything like that, it's going to cause them not to participate. So, Judy, thank you so much for your time today. We are going to miss you on September 10th, but we greatly appreciate you being here and being part of this event.
Well, hey, Mark, before we leave, you want to take a walk on our special art path, and we're going to go see the house. Okay,
oh, yes, the house,
star.
yes.
We're going to go see the fallen star, and I'm going to give the audience one more tip about suicide prevention. Okay?
That sounds awesome. Let's do it. So, Judy, this is a pretty impressive snake.
Yeah.
Where are we? What are we doing?
Well, the snake is part of our special Stewart collection. It's a collection of outdoor art. But what I really wanted you to see is that house off to the distance. So that house was designed by an artist who came to the United States and then felt so unsettled after moving away from his hometown, isolated, alone, disconnected, right? And a little off kilter. Everything felt just not quite right, like falling off the edge of a cliff. And that's what that house represents. Well, in America today, we have an epidemic of loneliness. And loneliness is one of the risk factors for suicide. So each of us has the opportunity to break through that. We can change. We can get rid of the epidemic of loneliness by taking action both at work and at home. So at work, do you meet the new people on your team? Reach out to them and invite them for coffee, invite them for lunch, make sure that they're socially enculturated into your workforce. Does the organization itself have ways to keep people connected? Then at home, do you meet your new neighbors down the hall or in the next house? So each of us has an individual opportunity to bust that epidemic of loneliness and that risk factor for suicide.